So and lobby or softball on those ones. So. name is Sid White. I'd like to welcome you to the community meeting, third quarter, comprehensive health updates, and also we have a guest presentation. Again, Sid White, here's my contact information, the Assistant Division Director. Always looking for feedback, input, community members, our number's there, please reach out. Housekeeping, this meeting format will be streamed. It'll be on our Facebook and also be on YouTube. We'll put it together. It'll be recorded. Our restroom locations are going to be outside the door here, male and female. We do have a light meal. If you haven't received a meal, let us know. Staff is here to assist. I would like to introduce our Division Director, Debbie Danforth. Thank you.
Good afternoon, everybody. We're trying something different by hosting this at the lunch hour, so we'll see how things go and what kind of feedback we get. So as we start out with every session, our vision for the Health Division is a progressive, sustainable health system that promotes Jeepney Unkweli Hoda, or our ways. Our mission is we provide the highest quality holistic health care to ensure wellness for our Oneida community. And the values for the Health Division are responsive leadership, safety, communication, culturally sensitive, respect, and trust is our foundation. So at this time, I'd like to take an opportunity to introduce to you our interim Continuum of Care Director, Wendy Wolter. Some of you may not be aware, but Dave Larson retired on May 30th. And so Wendy has very graciously stepped up and assumed the role of the interim Continuum of Care Director while she finalizes her preparation to sit for the nurse administrator's exam for the nursing home. So welcome, Wendy. Thank you.
So it's been my pleasure to work for the Oneida Nation over the past 12 years, taking care of the elders at Anna John. And I will continue to do my best as I do each and every day as I walk into Anna John Nursing Home. So thank you.
Thank you. So we do have some recognitions that we would like to acknowledge. One is for years of service, and the first one is for Connie Vandenberg for 40 years of service with the Oneida Nation. So thank you, Connie. I was teasing Connie this morning at the business committee. I said, I always know how many years of service you have because Connie came on board when I was going to go on maternity leave with my daughter. So you know how old Cece is if you've seen her. Another year of service recognition that we also acknowledged was Betty Schwantes. Betty has been with the nation for 30 years. Thank you, Betty. Our next one with a year's service is Kelly Walensky. Kelly is an RN within the medical area, and she has been with us for 25 years. And then our next year's service, also for 25 years, is Scott Lalonde from the Oneida Behavioral Health Department. So thank you, Scott. Now, I'd like to take an opportunity to introduce you to our student interns, our HRD student interns that have joined us. They're all going to be up and they're all going to take an opportunity. We said you have to have public speaking, so we're going to give them an opportunity to say a few words. So with that, our first one is McKenna Metaxen. McKenna is from the Division Nursing Rotations, and she's from the University of Wisconsin-Madison. McKenna, do you have a few words? Come on up.
Yes, I
Come on
have
up,
been
Kenna.
rotating throughout the whole. Okay. Hello everyone. I have been rotating throughout the whole comprehensive health division, and I am going to school for nursing. Thank you.
Thank you, McKenna. We jokingly told them that they're going to have to come up and say a few words so that we can give the audience the opportunity to say, who do you belong to?
Yeah. Who's your family? Who's your grandparents?
Okay, our next one is Margie Stevens. Margie is with us focusing on administration and public relations, and she is from the Wisconsin Lutheran College in business marketing major. Margie?
Hello everyone. My full name is Marjoria, but I go by Margie. I know it's kind of complicated, but as she said, I'm an administrator under Nate and Sid. So I'm just around here to help around.
Thank you. And our next one is Donovan Lalazern. Donovan is at the University of Wisconsin-Madison School of Pharmacy. Donovan?
Hi, my name is Donovan. I'm a second-year student pharmacist at the University of Wisconsin-Madison, and it's great to be back in the community again. I did a rotation here back in January and loved it so much that I decided to come back. So,
Welcome, Donovan. And our next one is Kaya Danforth. Kaya is physical therapy and health promotion disease prevention. She is from the University of Wisconsin, Green Bay. Kaya?
Hi everyone, I'm Kaya. I'm at UWGB, as she said. I'm at the physical therapy. My major is human biology with emphasis of exercise science. So my goal is to become a physical therapist or an athletic trainer. But I'm also at the health promotion and disease prevention, just kind of learning how it is over there, what they're doing. So very happy to be here.
Thank you, Kaya. So these are the young people that we're hoping to recruit in the next few years to come back and work with us. So thank you. All right, with this time, I'd like to take an opportunity to introduce Dr. Carrie Gleason. She's professor at the University of Wisconsin Division of Geriatrics, School of Medicine and Public Health, and she is going to present to you today regarding the work that's being done. So welcome, Dr. Carrie.
Thanks, Debbie. Let me make sure. Can people hear me in the back of the room okay? Awesome. Good. Okay. So, yes, I'm Carrie, and I'm from Madison. And so for those of training in Madison, come find me if you want any research experience, too. So I'd be happy to welcome you. I've been partnering with the Oneida Nation now for 10 years. So I have lots of familiar faces in the room. And I don't know how many people are online, but I welcome questions. I welcome conversation. So I really invite people to either look me up or come find me if you have additional questions as we go along. So I want to start out by acknowledging that I live and work on land that was ceded by the Ho-Chunk Nation. And this is important enough to me that I've thought about the fact that my family personally has generated has benefited from the generational wealth from stolen lands in Minnesota. So, and I'm kind of a big person about action, so I don't want to just talk about these things. So I want to actually try to do, dedicate a portion of my career to make sure that we're doing things to correct these inequities and these injustices. So, but I just start out by acknowledging that I personally have benefited through my family, and of course, many people have benefited from the wealth taken from stolen lands. So I also want to acknowledge too that many of us have been touched by dementia or Alzheimer's disease. Can I just ask for a show of hands in the room here? How many of you know someone with dementia? Or know someone who died of dementia? I raised my hand too. Okay. How many are worried about their own health? I raised my hand too. So yeah, of course. This work came about because of a conversation. So I'll get to that in a moment, but I want to just give a history of why this work came up. There was a comment this morning in the BC meeting about like why the Oneida Nation? Why are researchers partnering with the Oneida Nation? I will answer that question today. I also want to tell you a bit about like the history of this work. Is a foundational part of it is the Oneida Comprehensive Health Division and the ONCOA board, as well as what came out of that is the Community Advisory Board. So members of the Community Advisory Board are here today. I tell you about some current projects as well as some proposed projects, but there's lots of time for questions. Let me pose one more question to the audience before we get into the slides here. How many people know that there's something going on with Alzheimer's disease research at Oneida? Okay. How many people think we could do a better job of communicating what we're doing? Yeah, okay. So I really appreciate to Debbie and Sid for the opportunity to be here today to actually like try to address that concern. We need to actually be talking about what we're doing and not just, stay in our laboratories or in our ivory towers. We need to talk about what Oneida Nation's doing that's contributing to the story of Alzheimer's disease and addressing it. You guys should be, I hope you leave this being very proud of Oneida Nation's role in this work. So, okay, so let me move on to the next slide. So this is, I kind of hinted at this about why this work started 10 years ago. It started down here at the bottom, the roots of this tree, with a conversation at an Alzheimer's disease conference. So there was we've been a center now for 15 years. So we had a table at an Alzheimer's disease conference in the Wisconsin Dells, and a member of ONCOA came up to our table and said, "Where's the data on American Indians in this work?" And we had nothing to say in response to that. So I still have the original email from ONCOA, Wes, and Lois. Strong actually sent me an email and said, can you guys come up and talk to us about Alzheimer's disease? We want to know more about this. It's affecting our community, but we don't have enough preparation to really address it. So come talk to the ONCOA board. And that started the conversation. And you'll see from this tree here, though, that it led to so many other things. So there are several branches. And what I like about this is that I'm not at the center of each of these branches. It might have started with our group, but it's led to conversations and projects from lots of different organizations. So I'm not going to get into each of these branches. I'll focus on just a small part of them. But first, I just want to point out the timeline for this. So I mentioned that this started in the spring of 2015. 10 years have gone by. Wes looks exactly the same. I look a little bit older, but a few more wrinkles. Yeah, time has flown. It's been just an honor to be part of this journey, and this is too busy for you to necessarily get into the granular aspect of it, but I want to say that the research didn't start until like 3 to 4 years after we started conversations with the ONCOA board and started our own CAB. It started, we formed a community advisory board. So can I ask the community advisory board members just to raise your hands if you want to identify yourselves? Okay, thank you. They've been such great partners in sort of helping us steer in the right direction. I am so incredibly grateful for that. The Oneida Helping Oneida project, this is one that just finished. It started out in one direction. Our community advisory board said, you guys should be going in another direction. And so Mary Wyman responded to that, and it became an entirely different project. And to be honest with you, a much better project. So the community guiding our work is absolutely essential, and I'm incredibly grateful for it. So I think I built in, so why are we doing this? Why would Oneida care about dementia? And why would it be something that should be talked about or on the forefront? So among racialized groups, you're probably tired of hearing these types of data, but here's the reality is that American Indians are at, depending on what data you look at, maybe the highest or maybe second highest in terms of their risk for dementia. So, and we get a lot of questions. The follow-up usually is, well, why is that the case? Well, guess what? American Indians are also least likely to be included in research. So to answer those questions, we really need to do research in ways that include American Indians in the work, but not just include them in a number, but include them in responsible ways so that their voices are part of the research and part of helping us understand what the data are telling us. Because we come from a different perspective as researchers, where we need someone to help us understand what these mean, the numbers. Here's another really important fact. The field is making huge strides right now. You guys hear about the news in Alzheimer's disease? Do you kind of follow it a bit? Hear about the blood test for Alzheimer's disease? New treatments come online. And you're going to hear a lot at the end of July as our international conference is going on in Toronto. You're going to hear a lot more news then too about new treatments, how effective they are. There's a lot happening. And I've been doing this work for 25 plus years or so. And it's probably the most exciting time that I've seen in the field in terms of like new discoveries. Okay, but are American Indians being included in these discoveries? Are they getting access to them? And that is, to me, that sort of my why is I don't want to just talk about the injustices. I want to make sure that we're doing something about it. So recognizing that this disease is complex, it may not present the same way across different groups, that we need to have a diverse sample, and we will do better science when we do inclusive research. So I think I built in time for questions. So I thought I'd just pause at this point and see if there's any questions either online or from the audience in the room. Yeah, Sid.
One question that we heard earlier in the day was what is the funding source of these projects? And there were concerns that the goal was pharmaceutical companies trying to peddle medications on the population. So can you comment on that?
I sure can. I'll repeat the question just in case people online couldn't hear it. The question is whether or not the work is driven by the pharmaceutical industry, which at times has had motivations about developing, just medications, usually like pills or infusions and things like that, and about a profit really ultimately being the motivator there. And I can honestly say that I have no funding from pharmaceutical companies. All of my funding for this work comes from the NIH, National Institutes of Health. So it's funded by the public. So things are changing at the NIH right now, you might have heard. But I still have not, I really have looked to public sources for funding and institutional support from the university, as well as the NIH, or the entire, that is the sole source of funding. So, yes?
Have you tried to promote the type of work you're doing with other tribes in other states?
Okay, so the question is, have we tried to do this work with other tribes in other states? Yes and yes. Okay, as you can imagine, the work is heartfelt, and it requires the investment of a researcher and the community. Both individuals have to put the time in. So we are expanding to other tribes. In fact, my colleague Mary was at a meeting this morning with another tribe. So we are indeed expanding, slowly, not as fast as we'd like, but in large part because I want to do it in a way that's responsible. So that means that we have to have the large enough team to actually build those relationships and sustain them. I don't want to go in and parachute in and leave again in a year. So they take time to build. And the other question is across the country and other locations. Absolutely. Several of the projects I'll talk about today have sites in other parts of the country and even in Canada. So it has expanded. Thank you for that question. Okay, so should I go on? And stop me, raise your hand if you have questions as we go along. So, okay. So moving on to sort of the Community Advisory Board. So I get to talk about my friends in the room here. Our history. I just wanted people know what the advisory board is, what they're doing, what their goal is, and just so that there's, in the spirit of transparency, to make sure that people know what's happening in their own community. So again, I'm focusing just on a couple of branches of that tree, but I think we'll have lots of follow-up opportunities for us to talk about the other branches. So the Community Advisory Board, this is a busy slide, but it gives you the timeline. So we started out by partnering with ONCOA and having these kind of informal meetings with ONCOA. We'd come up and attend. We were fortunate enough to be invited, and we showed up. If you invite us, by the way, warning, fair warning, if you invite us, we'll show up. So be careful with invitations, right? So we ended up getting a BC approval for this in 2019 for the actual Community Advisory Board. I got funding from the NIH to start the Community Advisory Board to help coordinate the meetings, help with administrative support. It was a small grant. And subsequently, it's been supported by other funding that's been brought in, so related to that, the research work. So the Community Advisory Board. My co-chair is here. Where is she? There's Terry. Okay. So the co-chair, it's Community University Collaborative Group. So it's co-led by myself and my co-chair Terry. And the goals came from the Community Advisory Board themselves. So there's 4 goals: to guide culturally tailored outreach, education, and research. So the Community Advisory Board guides on that. They also help us reach middle-aged adults, military veterans, and youth. So let's go across the age span. Let's not just be talking about this with older adults, but we want to be talking about it with young people who might be caregivers. as well as middle-aged individuals. And we also want to reach another group, the military veterans, because it turns out military veterans are also at elevated risk for dementia. We want to reduce the stigma associated with Alzheimer's disease. The disease exists, and pretending it does not only adds to the stigma. So we want people to be able to say, I'm a caregiver for someone with dementia, and not feel like they're ashamed of that. For someone themselves to be able to say, I live with the disease, and I want to live as successfully as I can. And to continue those efforts to optimize culturally competent dementia diagnostics. Ever feel like you go to somewhere and you get a test done and you feel like this doesn't really apply to me? I'm not really sure how good these results are. So we've made progress on each of these aims. We have more to do. There's always more work. Luckily, we're energized to get up and address this every day. So that is the introduction of the Community Advisory Board. Here's a nice picture of us. This is the group. This is from last month, actually. We meet monthly. Oh, sorry, I'm probably in the way. We communicate, we talk. We have standing agenda items. So the agenda items include things like communication, the clinical work. We never want to forget that we want to improve clinical work as well if we can, as well as the individual research projects. This is, again, too small for you to look at, but it tells you about the different roles. I want to highlight that we try to get representatives from key areas in the tribe, including the healthcare, Oneida Comprehensive Health Division. UNCOA has representatives there. So we try to get key areas. If you see a gap and want to let us know about that, please do. Okay, pause again for questions. Any online or? Okay. I must be answering all your questions, right? Yeah, Sid.
How would somebody get involved with the Community Advisory Board if they're interested?
Okay, so I'll repeat the question. How would someone get involved if they're interested in being part or getting involved in the Community Advisory Board? Just contact us. You have my name. You could also, your fellow community members here help us with this work. Can I ask those individuals just to, the team that's working with us on the Community Advisory Board, just raise your hand. Thank you. Okay. For those who are online, I'll make sure that you all have contact information, for me at least. We can start there. All right, good, thanks. Okay, so moving on to the different projects. I'm going to describe 4 projects for you, okay? It's going to be a lot of information. If it does not make sense, it's me that's not doing a good job. So please let me know if you need me to explain things. So I'm going to start with that. This is another thing we do at the university for the trainees. You learn to talk in an alphabet, right? In alphabet soup. So forgive me if it sounds like that. The first project I'll describe is the I Care Project, and it stands for Indigenous Cultural Understanding of Alzheimer's Disease and Related Dementia Research and Engagement. Do you see why I don't say that name all the time? Okay, so I call it the I Care Project for short. This tells you the timeline. We are entering our last year of funding. So we're hoping we're going to put a renewal in, but not until the fall. So we're going to have a gap in funding. But I want you to pay attention to this purple box on the screen. And it says, what are you going to end up with at the end of the project? Okay? What you're going to end up with is this database of basically cultural understanding, where it catalogs the cultural understanding, the lived experience of Indigenous people around dementia. So we've had conversations with people who have dementia. We've had conversations with their caregivers. We've had conversations with their providers in communities who are caring for people with dementia. And the goal is to put this together so that we can go back and ground whatever we're doing by going back and looking at these data. There are several sites involved. This one includes a Canadian site on Manitoulin Island. Includes some sites in Minnesota too. So we have Red Lake, the Red Lake Nation, as well as Manitoulin Island and Oneida Nation as contributing to this data set. Data are owned by Oneida. Obviously, Oneida data are owned by Oneida. And what we'll do when we have things coming out of this, I have a paper that I'm working on right now that describes the caregiver experience. It'll go back to our community advisory board. It'll go back to comprehensive health before we publish anything. There's oversight to make sure that what we are writing about Oneida is consistent with the values and the culture. So that is the eye care project. So all the data collected are interview days. There are no samples collected. It's all just conversations. The next project is the Amica project. This one's close to heart to me because I'm a neuropsychologist by training. So remember I said that how one of the objectives of the Community Advisory Board was to make sure that there's culturally adapted tools for dementia work. Well, the Amica project, it stands for Addressing Alzheimer's Disease and Related Dementias Disparities, the American Indigenous Cognitive Assessment, or Amica. Okay, again, do you see why I call it the Amica? So the Amica project, we are just entering our 4th year of funding, just got our notice of award for that one. So we have 2 years left of this project, and we have a lot to accomplish. But I'm really excited about the end product. It'll be a set of instruments or tools that we can use to diagnose dementia that are adapted for use with American Indigenous populations. This will be work coming out of community that will serve community. You guys will be the first to be able to use these instruments. And you'll be able to say with full confidence, I know that these questions that you're asking me are appropriate. They work for me in my experience. So that's our end product from the Amica. And there's several team members here in the back of the room if you have questions about the Amica and the eye care project as well. Okay, last one I have 2 more. I have the Wisconsin Alzheimer's Disease Research Center. So this one is kind of late to the game in terms of our recruitment efforts. So I am part of a center. We are one of 30 some centers throughout the country. They come and go, but we've been funded now for 15 years, which is a good long period of time. And we've got a good track record, so I expect us to be around as a center for a lot longer. We have this cohort that we follow as part of our work with the center. So the idea is to understand the disease before you have symptoms all the way through to the end stages. So we ask people to come in and stick with us, come to Madison once a year. We're working on trying to change that to make it a Oneida-based assessment. But people come to Madison once a year, and we collect lots of information from them, including samples. This one has biological samples. The biological samples stay in Madison. We're very careful about making sure those samples don't go out to outside entities. If they do go out for testing, they come back, or the sample gets destroyed. They are not allowed just to go out into the public. And this is, I'll be honest with you, this is something that we are working very hard to maintain because the world is moving in a different direction with data openness. So there's a lot of people pushing to have completely open access to data. And we've really, from the get-go, put a policy in of being really restrictive with the samples and data. So we're asking people to come down and being part of this. And one of the first questions we're going to ask of it is to make sure that those blood tests work the same way that they do for in Oneida populations or in indigenous populations. Do they work as well when we look at this just within an Oneida sample? Our initial look at this suggests that the blood tests are working as they're supposed to, which is good. We want to make sure that they do. Yes, John?
Could you interject something about the IRB
Yeah,
and its importance in this particular part of what you're discussing?
I sure can. So John asked a question about the IRB. There's some initiative led by colleagues of mine who are working to try to set up an Oneida-specific IRB. It stands for Institutional Review Board. IRBs are boards that are put together of people who look over the science to make sure that it's ethical, that it's accurate, that it's done in responsible ways. Oneida does not have an IRB. Other tribes do have IRBs. But Oneida has its own process it's basically laid out how we get things approved. So it really depends on the tribe, their preference for which direction they go, but there's oversight provided by the tribe. So the Oneida work that we're doing is, to me, it's like the protection is for the tribe to make sure that somebody is looking over our work to make sure that what I tell you is being done and it's being done in ethical ways. Personally, I would love to have that additional oversight. It just is a great way to make sure that things don't fall through the cracks and that we've got that oversight. So I'll stop there at those comments, but just to say that IRBs are typically ways to make sure that someone from the outside is looking in and making sure that the work is being done as they say it's being done. So the center, the center is ongoing. We ask people to come in and we ask you to be part of our clinical core, and we ask you to stick with us until you can't stick with us. And the end product of that is that Indigenous people are finally being included in some of these major breakthrough work. So, all right, and I will say that all 3 of these studies are recruiting people. The Eye Care Project, we're looking for people with dementia and their loved ones to just have conversations with them or interview them. The Amica Project, we're going to start recruiting in the fall for people who are willing to do a memory checkup. And as we road test this new memory checkup, we're going to need people who have memory problems as well as people who don't. We're going to need both. We're going to need the full spectrum. And then the last one, the clinical core, is indeed looking for people to join this longitudinal study and to come back annually every year. Full disclosure, my husband is part of this clinical core. So it's one of the benefits of being married to a researcher. You get to be part of the research. Yeah, he's sort of my check-in person, just to make sure that things are going okay and that he's treated well. So far so good.
Are you getting paid to be the caretaker?
I did not. No money for me for this one, I'm afraid. Okay. All right, so a summary of the project's impact. This is, Debbie asked me to make sure that I hit this, okay? What does this mean for Oneida, okay? And this is, I'll put this out there. Maybe you, and I'm welcome, like if people disagree with these assessments of what the impact is, I'm happy to hear from them. The Oneida community is helping direct the research through the Community Advisory Board, through the Oneida Comprehensive Health. Absolutely, this is incredibly important. We need to do research in different ways so that it's not the researcher coming to the community and saying, here's what the protocol is, da-da-da-da-da. I gave you one example of how Oneida directed, the Oneida Helping Oneida. They changed it up. So they created a whole new research project. And in partnership, it's truly a partnership. So Oneida community is directing this research. The other benefit, I mentioned the Amica. The Amica, you'll develop a diagnostic test that is validated to work for Oneida citizens. Incredibly important. The Oneida Nation has this lived experience, is documented. Their lived experience with dementia is documented. You're part of an understanding. Like this will drive future work, developing intervention studies, for example. We're going to make sure that that lived experience is accounted for. And Oneida citizens are included in the research. And that's where you can say, well, is that a benefit or not? But making sure whatever comes out of these big discoveries that are happening at a national level or international level, making sure that there's some representativeness for Oneida and Indigenous people in general. So another possible benefit, if you think of it this way, is capacity building. We hire from community. We want the work to be located in community. In fact, that's one of our major initiatives. We're working to get a community-placed engagement site so that we pay rent to Oneida for being here. We want to work with Oneida businesses and catering. So the caterer we use today, we've used for our activities too. Great food, by the way. And we want to make sure that we are supporting the next generation and Indigenous leadership. So I describe myself as a placeholder. I want this work to be led by Indigenous voices and people. And there's so much talent. the struggle is not to find the talent. The struggle is oftentimes to keep people interested in academia, because it's a crazy lifestyle. I'll be honest with you. But yeah, if you have, I'm so grateful for my partnerships with Indigenous scientists who, and my goal is, like I said, to hand it off to their leadership. Okay, pause for questions. Yeah.
I had a concern with the, at the end, it was the funding being ended.
Mhm.
So this is a new concept in Oneida
Yeah.
that I just thought about. But I thought, well, we could, Oneida, while I was looking for funding, grants and everything, maybe we should turn it around and we become not a grantor. So we start giving money out to these different areas. And then that way we don't have to be everything. Because sometimes we think we have to be everything. We have to do it all, but we might be more, it might be wiser for us to give the grant, a small amount of grant money to this project, and well, we don't have to be everything, and you're doing all the work for us.
Yeah.
So that's just a new concept in how we do budgeting, or how we're not a grantor of any kind. We always receive grants. We might want to kind of just search that up and just kind of think about it. Don't say no right away. But think about it and say, how can we do that?
Okay.
Then my other question is, so I was wondering, because of the atmosphere of the politics in the United States, a lot of money is going to be diminished. It's
Yeah.
gonna be
Yes.
be eliminated and stuff like that. So how are we going to handle that part of the research and getting this stuff done?
Okay, I'll repeat both questions, but the first is that I mentioned that the iCare grant is in its last year of funding, and the comment was, well, maybe Oneida should fund research, you know, at least in part. I will never say no to money, you know. But at the same time, I feel like too that I think it ideally would be jointly funded, because people both have like investment in the work itself. And I'll, for me, in my career, I have more of an understanding of the NIH funding. So the second part of the question is, well, what are we going to do if that funding mechanism changes, or if the drive or the interest in the federal government funding research as a public endeavor, if that changes, what are we going to do? That is a great question. Something I've been thinking about since January 20th. I've been really focused on that, because there have been changes. I'll say though, I've actually not seen any dollar amount change on my front. I did have some VA funds that I lost temporarily, but they're coming back. It was a hiring freeze issue more than a funding issue. That's such a great question. I think I describe myself like water. If I can't get through one way, I'll find another way. So I've already started thinking about like other solutions for funding. So we've gone to a foundation for funding. I think what you always have to do is be able to be flexible enough to pivot in a different direction. So I think that's on the people who write the grants. It's on us to be thinking about that kind of creative solution. But I welcome partnership in this, in terms of like thinking through like a way to approach it. So good questions. I don't have great answers, but I'm thinking along the same lines. Any questions from the interns, by the way? They're awfully quiet. But okay. All right, so yes, Florence.
Can you say a little bit about the clinical research, like how much they get paid by participating and where it's coming from?
So the question is, how much do you get paid by when you participate in a research study? How much do you get paid? And then where's that money coming from? The money's coming from the NIH grants. So it's not coming from a pharmaceutical company in any way. It's coming from the federal government. And to me, you're not being paid to participate. You're being acknowledged for the contributions you're giving. And you're giving up. Oftentimes people have to take time off work or away from family. So I'm getting paid to be there. Why shouldn't you guys? So to me, it's a compensation for your time more than a payment for your data. And how much you get paid depends on the study, but we want it to be enough to make it worth your while, but not so much that you feel like like you're willing to do things you wouldn't normally do because it's so enticing. So it depends on the study. It's usually in the range of about $100 or so, $100. So enough to maybe go out to dinner afterwards, but not enough to like, you know. And yeah, and lodging is covered. Yes, we don't want you to pay out of pocket for this.
And your mileage.
And your mileage,
Yes.
yes. All right, so thank you for those questions. I think I'll go on. All right, so proposed projects. So this is where we, how much time do we have? Do we?
We schedule for one set.
As much as you want.
Okay.
Yeah.
Well, okay. We can talk all day. Well, I won't. These are things that we have in the works. You guys are getting a peek into my head here because I'm thinking oftentimes like this is the funnest part about the job is the chance to be creative and think about like directions to go in. So a couple of these that we have on there on the list here are projects that are in the dreaming stage. So they're not yet like maybe not even down on paper yet, but some are further along. So some have actually, at least one of these is being reviewed right now by the NIH. So it's all sorts of different levels of development, but none of these are approved. So lots of time to like figure this out and change things. So, and lots of discussion in the community advisory board already about these things. This is one I'm going to ask the principal investigator is Dr. Cornelius back there. If you want to raise your hand, Gala always, you'll notice she sits in the back of the room like this, but she's a leader in this work. So she with Dr. Lupke in the School of Nursing came up with this proposal to center training for Native American health professions here at Oneida. So Gala is a PI on a project that has a great score, and we're just waiting for the federal government to move forward and say that it's funded. So this is a grant called the NARCH, Native American Research Centers for Health. So this is, the key is that it goes to applicants who are, and institutions who are Native American in particular. So this is a grant to Glitzy, and Gala and Janelle Lupke are the PIs for the Oneida site. So I'll defer questions to Dr. Cornelius if you have any, but that is one not yet going, but it's in the stages of being considered for funding. This close. So if whatever you do, if you whatever lucky charm or if you pray, go ahead and send those prayers. So. IBACS, also again a really long name, okay, but it's the Indigenous Behavioral and Cognitive Symptom Checklist. There exist right now checklists that can be used to help identify these really kind of interesting symptoms of dementia, early dementia. So for those of you who knew someone with dementia, did you notice that their personality changed? Yeah. When did you kind of think it was changing? Was it right at the onset of symptoms, or did it happen before symptoms?
Before.
Yes, before. Okay, so if you can pick up on these really subtle things that family are noticing, you can do this with a checklist. That'd be great. But it's not been adapted for Indigenous populations. So we're proposing to adapt these behavioral and cognitive checklists, where we actually just have people tell us about the symptoms they're noticing, either in themselves or in their family members. So this right now, it's with the NIH and is slated to be reviewed in fall if the government doesn't shut down. We're a little worried about a government shutdown actually around that time because the continuing resolution expires. So if it gets reviewed, I'm hopeful that we'll have a path forward with that. The COPES project, also led by Dr. Cornelius. The idea, this is, I would give her full credit for this, Community-Placed Engagement Site, or COPES. The idea would be to bring the research to the community in the truest way. But this is a site, and we pay rent to Oneida, we hire from Oneida, and that it's Oneida team leading this work. And so it could be used for, if the COPES gets funded, it would be located here and staffed and run by Oneida. And this is, right now, the current proposal is with the Bader Foundation, so we're crossing our fingers and toes for that.
BC.
And with the BC, yes. It just got approved today. So I don't have the resolution, but we'll have a number soon. Okay.
Update?
Oh,
No more resolutions are required.
oh, interesting. Okay. We'll have to talk about that. Okay. Yeah,
Can you go back 2 slides?
sure.
It probably is an easy answer, but this is a will involve Indigenous Knowledge Keepers Advisory Group. Can you tell me what that is?
Yeah, oh gosh, yeah, I'm sorry. The Indigenous Knowledge Keepers, we created an Indigenous Knowledge Keepers group for the Amica project. This is separate from the advisory board. And these Indigenous Knowledge Keepers were created at each one of the sites. So they're holders of information and language and stories and culture that are making sure that whatever we're proposing to do in these tests or these checklists are not harmful to people, and that they honor history, and that they're aligned with cultural values. So they dig into this. It has been years of them going through our questionnaires and looking at them, talking through things. They work closely with an Indigenous Knowledge Keeper group in Albuquerque and in Red Lake, and they're brought together at a national level. It's a really fun group, actually, if you ever get a chance to see it. Yes, Gullah.
Yep, I just wanted to add that they're all members of the Oneida community, and many of them are Longhouse members, and some work for cultural heritage. So they're bringing in that cultural and traditional piece to make sure that the tool is safe in that way.
So the question, the comment too, just to add, I should have repeated the question, is who are the Indigenous Knowledge Keepers? And Dr. Cornelius pointed out that they're all members of the community, members of Longhouse. And yeah. Okay, let me go down to this one right here. This is in development. This is an idea stage. So I told you about the blood test for Alzheimer's disease, right? Okay, it's coming. Okay, it's FDA approved. So you could go to your doctor and you can ask for this blood draw. They have to process it in a certain way, and they have to make sure that it's stored and carefully done in ways, and they run it through this machine, and they can tell you whether or not you have the protein that is associated with Alzheimer's disease, beta amyloid, and they can also tell you about your tau levels and your other markers for things like neurodegeneration or inflammation that are happening in your brain. What do you do with this now? Okay, so there's now treatment studies. There are going to be diagnostic teams that are going to be doing this, but the Oneida Nation, why not have the Oneida Nation be front on this and have the Oneida Nation be able to do the test themselves instead of sending it out? And have them involved in ways where they're leading this. So what I want to try to do is put together a team of leadership where I've got the people who invented the test is signed on as a collaborator, Oneida Comprehensive Health Division being a collaborator, and Indigenous scientists from Oneida to be collaborators on this. But again, these are just ideas about bringing research to the tribes in ways that are, it's not the typical way of doing it, but in like the truest partnership possible. Yeah.
Who would own the biologics?
Who would own the biologics? Okay, one of the aims is exactly that. Like, let's work through the data sovereignty for that. So this is a really cool mechanism because you get 2 years of planning. So you could actually answer those questions why we're being funded to do the work, right? So often you're actually funded, you're not funded to write the grant or to actually like plan things. You're funded to actually execute the work. So this is a different mechanism that gives you that. Yeah.
So what's the difference between that and the biomarkers that we use?
Oh, yeah, good question. So the question is, what's the difference between the blood test and the biomarkers? They're the same.
Okay, just that one's faster than the other?
Yeah, the blood test is just one of the biomarkers. So you could go and get a PET scan, and that's a biomarker. You could also, there's other blood tests that do this. Or you could have your cerebral spinal fluid drawn, that's a biomarker. Or how many would sign up for the blood test instead? And And they're actually making it even easier. Our center is doing some really innovative stuff. They're doing like things where you can do like just a blood spot. You don't have to have the neopit. So all sorts of innovations coming. Why not have Oneida be at the front end of it? So anyway, I'll stop there. I think that was I think I just have some closing comments about priorities. This has been foundational from the get-go for the last 10 years that I've been partnering with. This is the feedback I was given. This is how I try to live this work. We make sure that the work that we're doing serves the tribe's needs. It's a career for me. I won't deny that. This is a career that has helped me do work that I love. And at the same time, it's something that's always made sure that we serve the tribe's needs and goals. And always give first with no strings. We came to Oneida, we weren't coming first with asking for recruitment. We came first to ask for partnership. Organic advocacy. It's so easy to find people who have been touched by this disease. That makes me sad. When you're touched by the disease, you tend to be more motivated to do something about it. Capacity building, making sure that we are supporting Indigenous leadership, we're hiring from the community, we involve Indigenous scholars and clinical trainees. Data, sample, and data sovereignty have to be baked into this work. And it's something too, like I feel like we're building the plane as we fly, right? We're learning how to do this, but there's experts that know how to do this, and I want to partner with them. And then culturally, cultural humility, safety, and dismantling colonization have to be also part of this work. And that might have been my last. No, okay. So I'm not done yet. Keep going. I just want to point out the key players here. People in this room, people who have been walked the path with me and been brave enough to to answer that email we answered an email from Wes, and it turns around now I will be emailing you quite a bit. So the people who are brave enough to answer the emails, the people who signed on to do this work, I'm incredibly grateful. So you'll see the names here of just people who are involved in the various projects. This does not include the Community Advisory Board. You saw their names earlier. But hopefully there's an asterisk next to everybody there who is either Indigenous or from the community. So, what do you think, Sid? Am I done? Okay.
Can be.
Okay. This is from one of those extra slides?
Yes.
Yeah, okay.
You want extra slides or not?
I don't. No, I'm good. Okay. I put some extra slides in because I always get questions about dementia. But you know what? Actually, Oneida is they know a lot about dementia already. We've been doing this work for 10 years, right? So, okay. I will stop there and make sure that, okay, there it is. The thank you slide. Okay. Yeah, what questions do people have? Yeah, Sandy.
I just have a comment when you talked about the international conference, Alzheimer's conference that is next week. It's going to be screened on July 31st over at Sasheen Lawrence's. That's over at Ridgeview Plaza. And she's going to have the screen set up for the day starting at 9 going to 4. So they're doing a lot of research. So anybody interested can just walk in, I think it's Suite 4.
Yeah, excellent. Thank you for that. Sasheen's in the back of the room.
Oh,
Actually not at my house, it'll be at my office. It'll be my office, at Plaza, Suite 4.
yeah.
And it'll be from 9 to 1.
Okay.
Oh, okay.
Okay, so this is, I'm going to make an announcement for people on Facebook. This is next Thursday, right? 9 to 1?
Yes.
Okay, at Ridgeview Plaza. Okay. Do you need people to sign up in advance? No?
That would be helpful because we are providing light refreshment.
Okay, so they want to provide light refreshment, so if you can let her know. If you didn't sign up, though, I'm going to just say that, just show up. You are going to be people who go to that are part of the international conversation around dementia. We have a colleague at UC San Diego who leads this community engagement work. She's really cool stuff. Making sure that community members feel educated enough to contribute to the scientific discussion. So you don't have to don't be intimidated. Show up and just, be there, and I promise you will learn things. Yeah.
I just have a comment. I'm getting emotional here.
Yeah.
I would, part of this when I was on the COA board and stuff, that people was asking me about it, and I said, you know what? I said, in the days, in the 70s and 80s, we were trying to get invited to the table. I said, now we are the table.
Yes.
I said, we have so many Oneidas on that table, so much leadership and so much, we just, when you say Oneida, we're proud and progressive, and we are, we should be proud and progressive of how we're tackling the medical field with our Oneida youth and everybody. So I'm just proud of what we're accomplishing.
I want to repeat that because it's so important. You were said, for decades and centuries, you've been trying to get at the table where the decisions are made. You now are the table. Yeah, and I agree. Oneida should be incredibly proud of that leadership. I have a friend who says, if you're not at the table, you're on the table. So I recommend be at the table. Yeah, it is really impactful, meaningful work, and it gets noticed. It really does. For those of my who are colleagues who go to these international conferences with me, yes.
I just think it should be recognized because Barbara is emotional about this, but her granddaughter's in medical school in Harvard. She's a junior and doing very well.
Okay.
So that's again getting involved and being at the table.
If she wants to work with us, we love working with students. So
Karen might get upset because she's a CNA at University. One of the most loved CNAs there.
Okay.
And she enjoys being that for the time being. She's working for Oneida Nation as a CNA.
Yeah, it is, and it is. It was such an honor. I will get emotional about this, but it's been such an honor to be invited into community and feeling welcomed, and so I cherish that. So thank you. You all can blame Wes, right, for inviting me.
They do.
What other questions do people have? All right, well, we are going to do a better job of communicating. So Facebook, I'm on a Facebook Live or a YouTube Live in September. So another opportunity. We oftentimes have articles in the Gully Wee Sox. Yeah, we'll be back. Thank you.
Just want to thank everybody for attending and taking the time. Again, this will be streamed. It'll be recorded. We'll put it on our YouTube link. As always, if there's any questions or comments, feel free to touch base. We do have the contact information, and then she'll hang around here to visit, have questions, come up to her. I know sometimes it's a little intimidating to ask in front of a group, but she'll be around, and we also have her staff that's here. Thank you.